And you can see Aligned Pilot Program.
You're ready to go.
Okay, perfect. So to answer the next question, the last question was Aligned Pilot Program. So this is South Carolina Perinatal Emergency Readiness, and it's specific training to our emergency departments. It's a twofold project. There are self-study modules, and then there's high fidelity simulation training with the high fidelity mannequins for the Sim Center here at Prisma Health. So there are self-paced modules. There are actually voiceovers. So each of the 6 modules are about 30 minutes or less. And it is myself talking about all of these different conditions, issues, how to do a normal delivery, what does a breech delivery look like, what are our cardiovascular emergencies that we need to pay attention to, how do we deal with hypertension, how do we deal with preterm labor, the neonate, and I thank all of the OB outreach educators, and also Bentley, who's one of our neonatal outreach educators that helped with the development of the modules. And then we have the simulation training. And so I call this the fast and furious perinatal training session. It is about 65 minutes per session, and we cover neonatal care, kind of how to take care of that normal healthy baby that comes out crying and breathing and doing everything that it's supposed to, as well as some NRP basics, because we know not all of our ED providers are certified in NRP. How to do a normal vaginal birth, because we know some of our ED providers, the last time they did a vaginal delivery was when they were in school. We do some notes on shoulder dystocia, severe hypertension, postpartum hemorrhage, and then a resource review with that. So here are some pictures from our first pilot session that we did at MUSC Orangeburg. The participants that came in were so engaged. They were so excited. They loved all of the tools, and they didn't want us to leave, which was really great, and a lot of fun to be part of that education. And then we just recently, in April, did our second pilot at McLeod Loris, and we've got some pictures here from that team doing their deliveries and resuscitating the baby in emergencies. And we actually had a live emergency come in with a pregnant patient on the same day at the same time. And we were like, we promised we didn't tell them to come do this on this day. But it was a really good kind of reminder that we're doing this education because these patients can present to us at any point in time. So some of the key resources that we are presenting and giving to the EDs when they receive this training, number one is a pregnancy stop sign. So we really would like for all healthcare facilities at check-in to be able to have some kind of stop sign. It doesn't have to be this one, but if it could at least have these questions: are you pregnant? Could you be pregnant? Or have you recently been pregnant in the last year? And so that way it should set up at sign in. Where do we need to triage? How do I need to triage? And what else do we need to be thinking about for this patient? The other side of this is the maternal early warning signs algorithm that really focuses on acute and subacute vital signs that we're concerned about in the perinatal patient. And then really kind of focusing in on some of the major issues that we have that lead to maternal morbidity and mortality in our state. And so that's infection sepsis. That is often, forgotten about. We don't really think about that as being a possibility. Those cardiopulmonary, like, does she actually have a cardiomyopathy, or could she be having an MI? Yep, she sure could. So what are those red flags? What do we need to be doing? The hypertension algorithms, and then we have medication algorithms that we also leave with them. And then OB hemorrhage, what is kind of the basics for that care? So we utilize resources that we already have in place from the AIM work that we do through the quality and safety work group through the BOI. So we have our OB hemorrhage checklist, and we also have our management of severe hypertension in pregnancy that has meds, vital sign reminders, dosing, how long you have to wait in between doses as a guideline. Obviously, if we've got providers that know what they need to give. This is just here as an extra tool. What we kind of say, like when you've got NRP going and everybody's got the NRP poster. So if you forget what you're doing, you've got it right in front of you. So this is provided in that education as well as in the modules. We're also doing some EMS training. It is an hour didactic and 1 hour of high fidelity simulation. The trainers for this have split up 8 different locations. So they're kind of doing regional training and then inviting people around these different counties and where those counties are regionally. And so EMS providers, paramedics are going to sign up for this and they'll get their hour didactic, and then they get to do these different normal delivery, shoulder dystocia, preeclampsia, hemorrhage, and neonatal resuscitation from a paramedic standpoint, not from a ED provider or nurse standpoint, but it's, what are you doing out in the community, at the home, and what do we need to do to stabilize and then get the patient to the emergency department. So we have, as we kind of already started to talk about, we have our data collection kind of plan in order to assess the utilization of the bands in the emergency care settings. Our pilots, as you can see, we started with MUSC Orangeburg. They were our first emergency department training, and then we did the train the trainer for the bands, and they actually got their bands in April. Then McLeod Loris was also in April, and because I already had the bands, they didn't have to wait on their bands, and they got theirs delivered on that day. We are scheduled up to go to Prisma Health Oconee and do their ED training on May 22nd. And the day before that, I'm going to be in labor and delivery doing the train the trainers and actually delivering the bands. So they should be distributing them shortly after. And then Colleton County for our low country is now been officially, when I did my slides, it was still tentative, but we have confirmed the date that we're going to be doing their ED training on June 25th. And then tentatively, I will do the train the trainer and deliver the bands on the next day. And then those EMS regional trainings are scheduled to start May 1st. So we've got a lot of things going on and really excited to see kind of how this all is going to, be able to be really established for all of our delivery facilities in the state. So right now, the ED trainings are going to be focused on emergency departments that have OB services in them, because again, we needed a really, for lack of a better word, a direct way and an easy contact for these emergency settings. We are asking when we're in an emergency department, if they have an urgent care center that's associated with their hospital system that's in the nearby area, they are welcome to invite some of those providers to come to that training when we're there doing that high fidelity simulation. But in thinking about this really comprehensive education plan, we start with the patient, right? The patient's always at the center of what we're doing. And then we have to think about their support system, family, friends, community supports, and then the healthcare team. And that's, OB, postpartum, inpatient, outpatient. And then what are our other community support programs, our WIC programs, our doulas, our community health workers. Lamika's on the call, so Family Solutions of the Low Country, our health departments, everybody that has other opportunities to touch these patients and encourage them to wear their bands, be aware of those urgent warning signs, et cetera. And then those other healthcare points of contact. So we've introduced these bands to pediatricians in our state. I was able to speak at the Q-TIP conference, the CATCH conference in January. We really want to start pushing this out to primary care. That's where Dr. Witherspoon comes into play with family practice, but really getting that specialty care, emergency care, urgent care, EMS, paramedics. We really want everyone in the state to say, you were just recently pregnant. Where's your band? I'm worried about you. Or if you've got a patient or an individual that you see in your community that's wearing that band and they start to have some kind of medical emergency, pregnancy, that it's not an unknown thing, that it's like, okay, we need to do something. And oh, they're wearing this band, they're postpartum. What's this QR code mean? How do we kind of get that word shared across the state eventually? So really for today, number one, I wanted to, just explain what this is, introduce the bands to you. We really are looking for improved recognition and understanding of the postpartum period across the board for the non-traditional obstetric care providers, as well as for the patients and their family and friends and the community. Really, really improved awareness of maternal urgent warning signs. What as an individual, in order to advocate for herself, be able to know what to be aware of, really improved assessment and improved early care in those non-OB settings to ultimately lead to improved outcomes for our perinatal patients. And that's both with morbidity and mortality here in South Carolina. So what is my ask of you? Promote this program. How cool is this? We've got these bands coming. We really want to get improvement in maternal morbidity and mortality. If you have a patient or a client that just recently delivered or had a loss, talk to them about wearing that band and making sure that they understand the importance of that alertness, not only for themselves, but also for their family and the community. And really, lastly, always encouraging patients to be advocates for themselves. I feel like that's been something that I have said my entire nursing career, is that I can do absolutely everything I can when you're sitting right in front of me, but I can't do anything when you're not right here with me. So I need you to understand that you can speak up for yourself and you can say something's not right. And I think that's really, at the end of the day, what we're really aiming to do is to improve those outcomes, because everyone is increased that awareness of complications that occur associated with pregnancy and postpartum. So I think that's really the end of my